Hi, I'm Dr. David Shannon. I have a dental office in Northridge, California. I'm on North Street between Tampa and Reseda. And I want to talk a little bit more about dental implants because I have a lot of patients that come in and this is something that's on their mind a lot. It's a word that's been thrown around a lot out there, and I just want to see if I can help clarify a lot of the dental implant technology that we have out there. Basically, what an implant is a metal screw that replaces the root of your tooth that you've lost. Now, unfortunately, people lose teeth. You probably remember your grandmother. She probably took her teeth out and had them in a glass when she went to bed at night, and she had to cut all her food up into little tiny pieces, and maybe she had a lot of gravy type of foods and soft foods that she had to slide down because she didn't really taste much and her teeth really weren't strong enough to really chew the steaks that everybody else were eating off the barbecue. This is very common, and what people don't realize that those dentures that she was wearing could be 1,000% stronger if she had a couple of implants, a couple of screwed in roots locking it all together. So that's what they did. They came up with this idea, I don't know, maybe 15, 20 years ago, and now all these people that have dentures that weren't able to eat, that were putting them in their pocket and weren't wearing them, and now they're able to use these implants for support. But what about all the other people out there that maybe you're missing half your teeth? Maybe you have the teeth in the front, but the ones in the back are all gone. Well, you can't go around chewing on your front teeth. I mean, that's ridiculous. You gotta have something to really work with. Otherwise, those teeth are going to start wobbling around, and you will be in dentures pretty soon. So every tooth that you lose becomes a tooth. It's kind of like, when you were a kid, you had nothing to do. It was a rainy day, and you put these little dominoes up, and you make a little pattern, and then you push one down, and then they'd all eventually go down until everything was gone. Well, that's what happens with your teeth. It's the domino effect. You lose one, and eventually, if nothing's done about it, you're going to lose more. And as you lose more, the other teeth eventually are going to loosen, and then you're going to lose all of your teeth. And you're going to go to the dentist one day, and he's going to say, we got to take out the rest of those teeth. And maybe you're, 50 years old, and you've just had your last tooth taken out. Well, 50 years old in today's world, you're going to live to be 85, 90. You've got a long way to go. You don't want to be an old person. You don't want to be taking your teeth out at night and putting them in a jar or putting them over by the sink and soaking them. And you know when someone's wearing dentures. You know what it looks like. I'll tell you. And you tell me if you know somebody like this. Because you don't have to be a dentist to spot this a mile away. Okay? They're usually older people, but that person has that sunken-in face look, you know what I mean? It's like their teeth. Why is that? Is it did they go to a bad dentist or something? They made them bad teeth? No, what happens is when you wear dentures, when you have no teeth left in your mouth, when you have that last tooth extracted and everything heals up, everything contracts. It gets smaller. And when there's no teeth in there and you're wearing these dentures and they start getting loose and they're rubbing and they're bouncing around and everything, it's because those gums are shrinking, and this is what's happening. They're getting all shrunken in the face. So when they're shrunken in, they're old. So when you see somebody with a shrunken face, you know they're wearing dentures. They're old. And you don't want to be old. And if you have your own teeth, you could be 90 years old. And you have a nice smile and everything looks healthy and normal because the bone that's there, the gums that are there, are holding those teeth in. Well, you know what? It works for implants too. If you have an implant in there, the body doesn't know it's not its own root. It doesn't know it's not a tooth. It's in there. And because it's in there, it holds the bone, and the gums hold nice and wide and round and firm, and you have that youthful look. So, if you have teeth that are missing, if you still have some teeth of your own, replace the teeth that are missing. It'll hold everything out. And just from a good look standpoint, it'll take 10, 15 years off your life. You don't have to go to some guy and have a facelift done or something. Spend your money on a vacation. Don't do that. What you do is you have a full amount of teeth. You're able to chew. You're able to eat. You're able to smile. You're able to laugh. You're able to go with your mouth wide. Nothing's going to fall and clack around like plastic teeth do. And you're going to be a much happier person. So I hope that this video has helped a little bit about what dental implants are for you as an individual to make you happy. We have lots and lots of videos out there. please go to our website, pick one in an area that you or somebody you know needs, look at it. It's only a few minutes long. You'll be able to really understand a little bit more about that. Come in and see us if you have to, if you want to, and you're nearby. We'll be more than happy to explain it. If you can't get to us, you're far away, get to another dentist. We want to help you. It's prevention. We're preventive oriented in the dental field. We want you to understand your own health. The more you understand, the better off you are, the more in control of your future you will be. So call the number at the bottom of the screen. Check out our videos. I hope this helped. Thank you.